first case presented at Opuwo Clinic on the 14th of August 2025 with the signs of skin rash, fever, cough, running nose. Then the team of clinicians started getting concerned and suspected this case because the signs and symptoms are suggesting measles. Thus, the surveillance task force, they are on a high alert on case detection. So the team of clinicians, they decided to keep or to admit the case in the hospital. And consequently, the blood specimen was taken and sent to the laboratory for testing and confirmation. So the result, when it came back that the case, it was measles positive. That's how we get the case. The situation is still under control. We can say it's calm because we are not getting cases all over. We are just getting cases mostly at one place, and all these cases, except the one of Ombado, which is about 40 kilometers away from Opuwo, they are just within Opuwo boundary. Places like Otudemba is within Opuwo boundary, and Ondunye is just an extension of Otudemba. They are all within the Opuwo boundary. Okasheshe village is about 1 kilo or 2 kilo there. Even Okovigava, they are just about 1 kilo from Opuwo town. So since we are just getting sporadic cases here and there, and that they are being suspected, we feel this situation is still under control and calm. Thus, the team is still just on the high alert, continuing investigating cases.
Now, we are informed that a team of health workers are said to be on the ground currently. How are they dealing with the matter?
Yeah, it's true. We are having a team of health workers in the field, ranging from the environmental officers, nurses, and community health workers. So they are there to respond to the outbreak. They are responding in a different way. The team of surveillance, they are doing active case search. They are visiting house by house and engage community members, asking some questions and do the observation. If they can pick up any condition which can be assimilated to measles or can be suspected for measles, any condition of skin rash, running nose, fever, and so on. We are also doing case investigation. Once they get cases, they will draw blood sample and then they send again to laboratory. Community health workers, they are there doing community education on the signs and symptoms, how to prevent measles, and case detection. Once they get any case whom they are suspecting, they call the hospital or the health facility. They inform them. Then a team of investigators will be deployed to such an area. At the same time, we are also doing contact tracing. You came from a certain village, like we are mentioning of Vinyange or Tudemba. Our team goes from those homestead and household to check now if they may get anyone again from the same household or homestead with such signs and symptoms.
Now, what emergency response measures are in place and how is the ministry ensuring that further spread of the disease is prevented?
Yeah, the Ministry of Health deployed already staff members, especially from Opuwo district, who are in the community doing community education and doing vaccination. We are vaccinating children from 6 months to 15 years.
Okay. Now, following the declaration of the outbreak, supplementary vaccination campaigns for the whole Opuwo district are currently underway. Please take us through what is required and what challenges have you encountered so far?
Yeah, thank you, sir. What is needed, we need just a sufficient number of nurses, meaning that the number of nurses right now we are having in Opuwo, they are not enough to execute this exercise. The letter was already sent to the ministry, that's National Level Office of the ED, to assist and support Kunene, where we got positive response for getting nurses, vehicles, and extra vaccine and other commodities which we indicated that we needed. We already got a positive response that the item will be deployed. Some of them were already reached Opuwo. They are here. That's why the team which is already in the field, they are continuing with the vaccination.
Now, apart from vaccination, Jason, is there any effective way to protect against this disease?
There's no other protective way of preventing measles. The only effective prevention is vaccination.
Jason, what message do you have for community leaders, schools, and churches in supporting the ministry's efforts during the campaign?
My call to the teachers, traditional leaders, church leaders is to support the Ministry of Health by doing community education and engagement, that they should encourage community members and mothers to deliver in the hospital, that also teachers at school, they should inform learners about the signs and symptoms of measles, and they explain to them clearly so that they will be able to pick them up back in their household or homestead there. Then they can inform the school management so that the school management can reach out to health facility. Traditional leaders, we are saying they should also get the correct information from health facility so that when they are engaging with their community, they should be able to alert them about measles outbreak in Opuwo district, about the signs and symptoms, and that if you pick up any case which you are suspecting, you should inform Ministry of Health. The community health worker there, they should reach out to the community health worker who can subsequently call the district. Again, at church, the traditional leaders should also talk about measles outbreak, the signs and symptoms, so that they sensitize the congregation members and they will be able to pick up those cases in their homestead. The correct information and leaflets, they are available at Ministry of Health facility, that they should also encourage community members to reach out to health facility for the correct information.
Mr. Jason, thank you so much for taking time to be with us here on Namibia Connects.
Thank you, Mr. Ivan, and thank you for Namibian Nation to listen to me. Let us disseminate this message so that our community members have the correct information and to ensure correct intervention on time.